Hello, my name is Syra Saman and I'm going to discuss the assignment on Planned Process Improvement through EHR. The objective of this assignment is to identify information needed for designing an EHR to manage a depressed patient based on their genetic information. There are 4 assumptions. Patient is first seen by his primary care physician at a private practice. He is then referred to a private practice of a psychiatrist. Patient already has a pharmacy assigned and he is suffering from an unidentified form of depression. The information needed for the first call to the primary care physician practice would be patient's name, date of birth, reason for visit, and whether he is insured or not. For his first visit to the primary care physician, the information needed will be demographics, insurance information, patient's history, signs, and symptoms. During the first visit, the physician evaluates patient's condition. He prescribes him an antidepressant medication and suggests a follow-up within a week. The pharmacy receives the prescription and patient is given the medicine in a day. However, after his follow-up, the physician makes a referral for the patient and he is referred to a psychiatrist. During his first visit to the psychiatrist, the information collected is his reason for visit, the referral, his demographics, his social and medical history, and the insurance verification. To understand his depression, the psychiatrist orders a DNA kit from a genetic laboratory for the patient, which will arrive in few days. Meanwhile, the patient is prescribed another antidepressant medicine and talk therapy. When the DNA kit arrives at the practice, the patient is asked to show up. Sample of his saliva is taken and the kit is sent back to the genetic lab. The patient continues the same treatment. In the third follow-up, the psychiatrist evaluates patient's condition and sets him for another follow-up within the 4 weeks. The initial treatment is continued. Within 8 weeks from the first visit, the psychiatrist receives the genetic information. EHR is updated with genetic information, which reveals the kind, severity, and features of his depression. Patient is prescribed a different antidepressant and the prescription is sent to the pharmacy. The patient is asked for another follow-up. The treatment based on his genetic information seems to work for the patient. His condition improves. This shows the roles of and the action taken by the primary and secondary actors. Multiple actors deal with the patient's record. However, it is the psychiatrist and the genetic lab who exchanges genetic information with each other. This diagram shows the flow of information and the point in time when patient's information was analyzed and treatment was changed. In short, this process suggests when and what information is needed for the EHR, how the information is accessed among multiple actors, and how the genetic information manages the treatment.